Welcome back, and thank you so very much for joining us today. We have as our guest another whole department from Andalusia Health, and it's a physical therapy department. We have Miss Haley, Miss Andrea, and Miss Niva. I want to say Neva so bad, but it's spelled like Neva, but it's Niva. And they're so sweet to let me mispronounce their names. But that's what physical therapists do. They help handicapped people. So we ought to have a good time today. And it's such an important department. It truly is. Tell us a little bit. Haley, you start and y'all just fill in and tell us a little bit about where you're located physically. And one question I've got, is the only way you get to see y'all is through a physician's recommendation, or can I say that my back hurts and I want to see you? What do you think about all that?
Typically, we get a referral from a doctor.
Okay.
Alabama recently got direct access where we can see someone if they have recently seen their physician and didn't get a referral. We can request that from the doctor. We're located in the back of the hospital, around near where Dr. Burke's office is.
Yeah, I love Dr. Burke. He's got a heart of gold, doesn't he?
Mm-hmm.
Now, Andrea, if you go in the front door of the hospital, is that how you do it, or you drive around back?
Drive all the way around to the back. We're at the very back of the hospital, near where the old ER used to be. That's where we're located. They're signed for physical therapy patient parking. So drive all the way around the back until you see those signs, and we're at the very back there.
See, I hadn't been back there, and so you didn't know if it was acceptable to park back there, but it's
Right.
the public
Yeah.
parks there, and they're just well. Y'all have wonderful signs to the walk-in clinic and to all the doctors, so that's great. How long have you been a physical therapist there, Miss Niva?
I'm one of the old ones. I guess 28 years.
Really? In Andalusia?
Oh, no, sir.
Okay.
I've done a variety of different things.
Okay.
Been a variety of locations. I've taught a little bit and worked just in a variety of settings.
Well, we have a new imaging department that's open for the public a lot of hours for women that work, and that's been a great. And we've got a new cardiologist, Dr. Price, and we've got, of course, Dr. Burke getting that new, but he's new. He's an internal medicine specialist. And then we've got Dr. Kelly with the knees, a new orthopedic surgeon. And when he gets through operating on knees and hips, do they come see you? Is that the next step in the chain of command?
It is typically. We recommend it. Now, sometimes they'll go to a different type of rehab setting first, depending on their functional level, how well they're doing after the surgery. For instance, sometimes they'll go to a nursing home first for a temporary rehab stay, or they may go to inpatient rehab for 1 to 3 weeks for rehab. And then generally the progression is to outpatient physical therapy.
Well, I noticed that I had my knee scoped, and the outpatient surgery wing is what used to be the physical therapy a long time ago. So do y'all have, do y'all have a new facility in the back of the hospital? Do y'all actually have, when somebody's in the hospital, you bring them down to physical therapy?
We usually treat them at bedside.
At bedside?
Yes, sir.
Okay. I didn't know how that went, because to me, physical therapy is just as important as surgery, if not more so. You try to get them back on their feet so they can be ambulatory and do things for themselves, like use the bathroom. That's important. I mean, if you've ever had surgery, that's really important. To be able to take a shower is very important. Not to have somebody constantly having to care for you. And y'all are busy all the time, aren't you?
We stay pretty busy.
Yes, sir.
What are the physical therapy hours? Is it 24 hours a day, or is it certain hours during the week that department's open?
For outpatient physical therapy, we treat patients from 7 in the morning till 5 in the afternoon.
Okay.
And then for acute care, which is mainly what Nava does, it's sort of all hours. We can get referrals at any hour, but it's typically the 8 to 5 that we see the patients.
What's acute care now?
That's the patients that are in the hospital.
They're in the hospital.
Yes, sir. So I see them immediately after, the day after a knee surgery or a hip surgery, and that's our orthopedic population. And then we also see people that have pneumonia or breathing problems, or
Yeah.
have had a stroke, just any type of
That's
type of
wonderful, though.
diagnosis.
You know, you don't think about people that have pneumonia and strokes needing physical therapy, but certainly that's true. And especially, gosh, if you've ever had a bad cold, you know how hard it is to breathe. But somebody that has actual pneumonia, that they need somebody to move them around and get it going. They sure do. And now we have more than one orthopedic surgeon. I imagine that the orthopedic population has increased a little bit. Because I know Dr. Kelly's busy all the time, and I know Dr. Holland's been busy ever since he got here. It seems like he just got here the other day, but he's been here since my little boy was one of his first patients, and now he's 30 almost, so 25, so there you go. Wow. And do you have a check-in office like for the outpatient, just like they do for imaging and all like that? You go to a desk and prearrange everything, or like if you go to a physician, he refers you there, he faxes your information over or something, you know that I'm coming? Yeah.
So sometimes the physician's office will fax over an order, and Becca, our secretary and also our financial counselor, she'll contact the patient. Sometimes patients just bring in a script, which they're welcome to do. They'll say, I got this order from my doctor, and they can set up a visit in the clinic at that time. But generally a patient, on the day of an initial evaluation, when it's time for them to get registered, they'll come in, we gather the order, their identification, insurance information, and Becca will register that person in the clinic there. So
Right.
it's all still around the back of the hospital, and then our gym is adjacent to the office there.
Okay, that's what my point was, that it's very convenient. You don't have to go to the front of the hospital and
Right.
sign in and then drive around. You
Right.
go to one place. And that's what I really love about Andalusia Health. I mean, you can pre-register now. You can, you know what you're going to do when you get there and where to go when you get there. And that you know, so many people are reluctant to go to a new place because they're timid and they say, I don't know where physical therapy is. And that's what we want you to know, is that they have an office right behind the hospital, and was in the hospital, was in the back side of it, and that when your physician recommends you, you're going to be set up to go, and you're not going to have to wait around 2 or 3 days.
Right.
And because most people that need your help really need your help, they hurt somehow, and y'all don't prescribe medication. The doctors
Correct.
do that, and y'all help people get off of medication. Is that fair to say? Do you work in conjunction with physicians to get people to get off of pain relief medicines and things?
Oftentimes that does happen as people are recovering and their pain levels are decreasing. They find that they don't have to take their pain medications as frequently. Certainly the stronger pain medications after a surgery, patients will begin to take them less often until they don't have to take them anymore. It's the goal.
Because the older population, some of us are just not tolerant to those drugs at
Right.
all, and it's very inconvenient to take them. I know that you have to take something for pain, but once that physical therapy starts working, things start, getting on a natural scale again. That's your whole goal, is to get people back to their natural best
Right.
self they can be. And that's what Andalusia Health's all about now. Instead of being like a hospital, they're about better health for whatever way it's possible. And do y'all have imaging there, or do y'all have to send people to the X-ray to get imaging
Yeah, we don't do imaging in
at
our
all?
department.
Okay. And do y'all do sports injuries?
Certainly, we see a lot of sports injuries every year.
So when a football player goes to Dr. Kelly and he does what his magic, then they go down to you, and do you have like a hot tub and things like that anymore?
No.
You used to. That's what you think about, a big thing that you see the football players getting in the ice and all. Y'all don't do that, do you?
We don't. We have some electrical modalities that are very effective for pain reduction. We have ultrasound, and it's therapeutic ultrasound. It's not where you get a picture. It's a similar technology, but a different setting and a different purpose, where it can help to decrease inflammation, it can help to stimulate faster tissue healing, and it can help to reduce pain. So we have those options. We have, for patients with spinal problems, we have a traction table that can help to decrease the pressure on the nerves. We use that with some of our patients, and then we have hot packs and cold packs. We do still use those every day,
Okay.
but not so much the hot tub. So certainly we have several modalities and things that can help to reduce pain
Okay.
available.
Well, that is great to know. And how many people are employed at the physical therapy part? You know, you got a pretty large staff?
We have 3 therapists, 5 PTAs, and Becca, our secretary back there.
Okay. Well, how'd y'all taking a lunch break to get up here today? So who's minding the fort? Who's looking at the store when y'all here?
Now on Friday afternoons we don't see patients during
Oh,
the
okay.
during the afternoons. A lot
Okay.
of times we're catching up on patient paperwork and handling things on.
Yeah, there's a lot of
There's
paperwork
a-
involved in it.
there
There's
is,
always
yeah.
a trail. And then, of course, you take people that are in the hospital and they've had surgery and they need to get their arms moving again, their legs moving again, and so that's really important to do that critical care. I imagine that's a daily operation, isn't it?
Yes, sir. We treat patients upstairs 7 days a week.
Oh, that's what, okay.
On the weekends, we treat them once a day, and during the week, twice a day.
Okay. Because you want to get them out as soon as possible. Okay. Well, you know, it's great to have Andalusia Health. I see ever since Mr. John Yang's been here as the CEO, things have really perked up out there. You see a new department every day. You see people coming in and doing preceptorships. You see people, it's almost becoming a teaching place and a learning place, and it's certainly a healthy place. Have y'all eaten in the cafeteria lately?
Oh yes.
Pretty good, isn't it?
It is.
That's 2 steps up too. They get gold stars,
Mhm.
and checking in and checking out is a breeze compared to the old days.
Mhm.
And so I think it's really a family friendly place, Andalusia Health. And
One new program that
Okay.
the physical therapy is going to be starting soon is a joint camp or a joint class. And we're going to try to bring in patients who are going to be having a total knee replacement
Right.
or a total hip replacement, and educate them beforehand, let them know what to expect and what's going to be happening.
well, I'd like to take that class.
We hope to do that, we hope starting in September. We don't have quite a date yet, but hopefully in
Right.
September.
Well, that is wonderful because it takes a lot of the fear out of the procedure you're about to take. My greatest fear was being put to sleep, and then they did an epidural, and I've never had an epidural before, and that's the way to go for outpatient surgery. That's a piece of cake, you know. But then when you have people that are actually replace a whole knee or a whole hip, then they absolutely. How many days of therapy does it take before you get out of the hospital?
Usually 3 to 5.
That's not bad.
No, sir.
That really isn't bad. And it used to be like a month-long process, and now y'all got it down to a science. Well, it's been great having Andalusia Health visiting with us today. If you're interested, if you're watching this program, you can always contact the hospital. You can always contact your local physician and ask to be referred if you have a problem that you think you need physical therapy, or if the doctor, of course, thinks he'd listen to him, he's probably telling you the truth, you know. But it's so great to have y'all here today, and thank y'all for coming, and thank y'all for watching. And remember, Andalusia Health is about health now, so you're not going to catch anything by getting healthy.
That's right.
Thanks for watching.